Welcome everyone. This is Gail Strack from the National Family Justice Center Alliance here in lovely San Diego, where we have great weather today. It's sunny, 80 degrees, and I hope everyone is having great weather wherever you are. For those of you who have joined us for the very first time and you're hearing my voice for the very first time, I'm Gail Strack, the CEO. I've been the CEO for the Family Justice Center Alliance almost a year, actually a little over a year, and I have said to everyone this is the best job I ever had. But then again, when I was the director of the Family Justice Center, I said that was the very best job I ever had, and I had the privilege and honor to be the director of the San Diego Family Justice Center for 5 years, and before that I've spent the majority of my career as a prosecutor working on domestic violence, child abuse, elder abuse cases. So this has been my life's work and passion, and it is something that I would certainly recommend to everyone. Today we want to give special thanks to our sponsor, Verizon Foundation, for helping us make this particular topic a topic that we can share with others throughout the United States. We have some dynamic speakers and leaders in their own community who will be joining us today. Let me give you an overview of today's webinar. Hopefully everyone has a chance to now see it. We're going to advance the next slide, and hopefully everybody can see Forensic Medical Units, and if you've got that one, you know you're in the right webinar. We'll advance one more, and here's what we're going to do today. We're trying something different from our prior formats of doing webinars. We want to create this one more of a discussion and a lot of questions and answers, because this is a growing field for family justice centers and those family justice centers who are just getting started and are trying to sort out how to start a forensic medical unit in their center. So what we're going to do is we're going to give each one of our centers who are joining us today. We have the Alameda County Family Justice Center. We have Boise faces in Boise, Idaho, and we also have the Nampa Family Justice Center. Each one of them have started a forensic medical unit, and they're definitely on their way in this developing new program at our centers. They will each give a 5-minute overview of their program. We will do some frequently asked questions that we've been receiving here at the Alliance, and then of course we have asked for and received questions from the field. And it's not too late. If you come up with a question during this presentation, please send it in. We have two wonderful ladies here at the Alliance helping us today, Jennifer Bodine and also Brenda Lugo. They are tracking and helping me keep this thing going and also tracking all of our questions. So let me just give you a brief introduction of our speakers. Then I'll go into some resources and a little background for you of the San Diego Family Justice Center. Today we have Nadia Lockyer. She is the director of the Alameda County Family Justice Center, which opened in August of 2005. She's an attorney and was admitted to the state bar in 1997. In reviewing her bio, which we will also add to our website so you can see the background that this amazing woman has. She's done fundraising, she's done pro bono work, and I think one of the things that I was most impressed with, at age 27, she ran and was elected to the Santa Ana Unified School District. She served as the president of the Board of Trustees there, and it was one of the 5th largest districts in the state of California. So I thought that was like, wow. She's a go-getter. Obviously, when you read her bio, she's a woman who cares about her community. We also have Rebecca Lovelace, who is the director and has been the director since the opening of their center in November 2005. And it's one of the things that I think Family Justice Centers is doing is just warming the hearts of each and every community. And for the Nampa Family Justice Center, they have been hailed as the most collaborative, innovative program in the state of Idaho. And I think that's what funders are seeing, is the collaboration that's happening as at each of these centers. Rebecca also comes with years of experience doing work in the field of domestic violence, whether it's alternative sentencing, a probation officer, or working at the crisis center. Rebecca definitely is a woman who is making a difference in her community, much like Kevin Mateague, who is joining us today. He's the director of the Boise Center, which opened up in July '06. He has a master's in public affairs and a long history of being an operations officer in the health field. So he comes with a wealth of experience in opening up his center. Their center opened, as I said, July 2006, and they have two independent forensic medical units operating there since 2006 and also in 2007, but he'll tell you more about that. And Kevin was smart enough to bring Cindy Cook with him, and Cindy is a registered nurse, and she's the coordinator of their SART program in Boise. So she's going to, when we get to the details of running their unit, she's going to share that with us. I understand she's a registered nurse, and she is on site there in Boise and does the actual examinations. So moving forward, a couple of resources for everybody joining us. We have two books. One is Hope for Hurting Families, which we like to say is the why, and How to Start a Family Justice Center in Your Community is the how. And in that particular manual, number 2, we have chapter 14, which Dr. George McLean helped us write and put together. And what that particular chapter does, it just walks you through launching a family Justice Center's Forensic Medical Unit. But each of our speakers will kind of go through each of those steps and what they went through in launching their center, their vision, their mission, their goals, their objectives, which is all fun stuff that you need for grant writing, designing the Forensic Medical Unit, the name of your facility, which I think for me in particular, I would probably rethink that, the Forensic Medical Unit, because you do want a name that is definitely welcoming. Sometimes the name Forensic Medical Unit can scare folks off, so we might have a discussion about that today. Determining your scope of services, what you want to focus on, your staffing levels, and when it's time to get going, how you're going to find that money, and of course, always collaborating with academic affiliations. So as a little background on the San Diego Family Justice Center, which opened up in February 2003, we were lucky enough to receive a grant to get us going, and I want to give special thanks and recognition to Dr. Ellen Tolliver. We went to Texas to see her program there, and Dr. George McLean, along with Sharp Hospital, who helped put this together. We also relied on a whole steering committee. We invited just about everybody in our community, from doctors, nurses, administrators, police, prosecutors, to help us design our particular forensic medical unit. And as you can see, the scope of services has started off with domestic violence, but soon went into elder abuse, because once you have a family justice center, you will see that all issues come in. Many people need your services, so we started to focus on elder abuse, child wellness checks. The nice thing was, because we have so many medical schools in our particular area, we were able to start a residency program. And then, of course, our international students really enjoyed working at the Forensic Medical Unit. And then, of course, forensic internships and volunteer nurses. And that all helped with designing some wonderful research ideas that we hope to implement in the near future. Moving right along, I just want to give you a visual of what the Forensic Medical Unit looks like at the San Diego Family Justice Center. It has 2 forensic rooms, one for adults, one for children. We also have a bathroom in the middle that's ADA approved. And then I wanted to give you an overview of some of the family justice centers that have forensic medical units. In California, the ones that I know about are in San Diego and Alameda County, and of course in Texas, San Antonio. Bexar County is located at a medical facility, which is a very unique family justice center and doing great work. Boise and Nampa, Idaho, of course, we're going to be talking about today. And then most recently in Indiana, a unit just opened up at St. Joseph's County. The Boston Family Justice Center, Croydon Family Justice Center, and Waterloo in Canada. So it's a growing field. With that, I will now turn it over to Nadia and welcome her and thank her for sharing her valuable time with us today and telling us a little bit more about the Alameda County Family Justice Center's Forensic Medical Unit. Nadia?
Hello. Good morning, everyone.
Hi.
It's always good to connect with all of you. Are you able to control the screens, or
Yes.
I can't do it from here, can I?
Yeah, I'll be moving the screen. So
Okay.
just tell me when.
Welcome to the Alameda County Family Justice Center. I'll go straight into the Forensic Medical Units. If anyone has any other questions about the center, I'd be more than happy to answer them. our forensic medical units and our public health clinic opened at exactly the same time that the center opened. On site, we have the Alameda County Public Health Department's clinics. And I put that here because they're so, intricately intertwined with our forensic exam rooms. That team is composed of a project director, 2 nurses, a receptionist, and their scope of services include immunizations, STD screenings, aftercare, and basic follow-up. They are located on our first floor directly next to our sexually exploited minors program and our Youth Justice Initiative and Deaf Hope. So we've seen a humongous increase in our SEM population utilizing the clinics, as well as more recently through our navigators, the referrals from other partners for children's immunizations. So I include here the child and youth wellness checks, so our safe in-home screenings. Included in that is referrals to other medical and social services on site, specifically Purple Ribbon that is just down the hall on the same floor that does all of the public insurance program application forms for victims of domestic violence and sexual assault. So whenever it's discovered from any partner throughout the building and off-site that somebody does not have public health insurance, they are linked in directly to Purple Ribbon. And so they assist survivors with enrollment into Medi-Cal and other insurance programs and provide referrals to dental, mental health, and substance abuse programs. And, of course, through that clinic, the care to our teen victims of sexual abuse and exploitation and domestic violence has dramatically increased. On our second floor, and that's the photos that we do have here, is our forensic exam room. It's located directly next to BAWAR, Bay Area Women Against Rape, that does the court accompaniment, ER, direct response, and all of the advocacy and counseling care to victims of sexual assault. Hillary Larkin, who is on my management committee, is a physician assistant. She's been 20 years in Highland Hospital's ER as medical director. She is a full-time employee with 13 physician assistants that are all certified forensic examiners. She is assigned specifically to Highland Hospital, yet she and her staff, they do respond to FJC calls for exams here on site at the Family Justice Center. On site, directly in hospitals, our partnerships include actually 4 hospitals where there is active partnerships. Our goal, as it says here, was to regionalize forensic exams so that victims could actually stay where they are and not have to necessarily come here. So through video relay and video relay systems, I'm sure everybody's familiar with it, but just in case, is when you can actually go into a private room and speak through a television to an advocate or counselor or officer here on site at the Family Justice Center from where you are at in the ER. And that allows, the direct communication with all of our service providers and most importantly, our navigators here on site. So we have video relay systems in 4 SART centers, and again, because we're a countywide entity, that's always, has been a challenge, but this has been the most useful way that we've been able to reach out our arms out, countywide. So that's in the Center for Child Protection, which serves children 0 to 12, in Highland Hospital, in Valley Care, and in Washington Hospital. Funding for all of these is very, very, very eclectic. I can get into more detail of that as we, I think, discuss that later in the program. But generally, it's public health funding and grants, hospital funds, victim compensation and government claims board reimbursements, and some law enforcement funding, of course. So number of clients served. In Highland Hospital alone, there was, over 350 domestic violence victims and 250 sexual assault victims each year. Public health, our clinic on site, so far this year has seen 1,203 folks. SARTs generally countywide, this is a number from last year. I'm sorry, actually that's from 2006. So approximately 600. It's actually 600 to 800 per year. The average is almost as many kids as adults. And that's it until we have further questions about funding.
Okay, well, thank you, Nadia. I am so impressed each and every time I get to hear what you're doing. I love the purple ribbon idea. Fantastic. We're going to now turn to Boise, Idaho. Kevin and Cindy, are you there and ready to join us and tell people about your program?
Yeah, we're ready. I have Cindy Cook with me. She can address some of the questions and overview of our Sexual Assault Forensic Examiner program. FACES, that's Family Advocacy Center and Education Services, opened in July 2006, and our center was really built sort of on the foundation of a partnership with the hospitals and bringing in two forensic medical unit programs, the first being the Children at Risk Evaluation Service, or CARES, which is an arm of our local St. Luke's Children's Hospital. The CARES program is really the child advocacy center in this area, and they were integrated into our Family Justice Center, so they occupy almost half of our center. And they have on site here a pediatrician and then two pediatric nurse practitioners, as well as social workers that do forensic interviews of children who have been physically and sexually abused. And so they are doing a pretty broad range of services. They're very medically oriented, but they are also collecting forensic evidence and doing forensic medical exams, as well as the forensic interview with the children. They are funded partly through the hospital, partly through the Crime Victims Compensation Program here in Idaho, as well as assorted grants underwriting the programs. They have seen, since they opened in July of 2006, they've seen 1,800 children in the center, so they've been very busy. They're seeing about 950 or so a year of kids, and that's a real mix of sexual abuse and physical abuse cases that they're working on. And they also are running a foster care clinic program in conjunction with our child protection system. And so children that are being put into foster care come to our center and are receiving, essentially it's a well child check, getting a full physical exam before going into a foster care placement. And many of those kids have already been through the CARES program prior to that foster care placement. So some of the kids are familiar with our services here as well. The SART program, we call it SAFE, Community SAFE for Sexual Assault Forensic Examiners program, is a cooperative program between our two hospital systems here in Boise. And they have put Cindy Cook, their program coordinator. They actually took her from a half-time position, made it a full-time position to work here at FACES and really fully coordinate and develop that program here in FACES. And we have, through this program, effectively moved about 70% of the forensic exams for sexual assault victims out of the hospital emergency rooms and into our center. And we have real strong support particularly from the emergency room physician groups that staff the two hospital two hospital emergency rooms, and they are giving us quite a bit of financial support just for FACES to operate our program because of the positive impact it has on the emergency room, and it's a better way to work with the victims. I'll let Cindy just talk a little about the services and programs that they offer through the SAFE program. Cindy?
So we really have a pretty unique collaboration between the two competitive hospitals in our county here, or in our city here, St. Luke's and St. Al's. We have nurses from both hospital emergency departments that work for the SAFE team, and we have done, since we opened May 14th, 2007, we provide 24/7 availability for forensic exams anywhere from 14 years of age and up. We have done 143 call-outs here last year with 110 forensic exams completed on those. On the ones that we see, we are based on protocols, we have 2 medical directors, one from each of the hospitals that support our team and provide oversight as well as signing for our standing orders for the medications. We do medical histories and interviews. We do the head-to-toe assessments, of course, with the medication for prophylaxis, and then the forensic exam and evidence collection, as well as referrals within our community for follow-up testing. For our availability to physicians, we are able to call at any time, 24 hours a day, the physicians that are on service in the emergency department, and we do a medical screening before we begin our exams. And then we also have telemedicine set up here and able to use, although we've never had to use that yet.
And that's, in some ways, our backup system, because we're not practicing emergency medicine, and so much of this work has been previously done in the emergency rooms. It's given us the ability to, if there is any question, to immediately contact a physician, have them speak directly to the patient. We have the RN here to take vitals, and we're able to make a call. I think we've only sent a couple of people back to the emergency room since we opened in May of 2007.
In fact, there's only been 2 that have been sent to the ER, one for injury-related follow-up care and the other one for patient preference.
Okay. Well, thank you, Kevin and Cindy. That was very informative and also heartwarming to have 2 competitive hospitals. That's not easy, and then to have them come together, that's like, wow, congratulations. Okay, we're going to go to Rebecca Lovelace in Nampa, Idaho. Rebecca, tell us about your program.
My program here at the Family Justice Center in Nampa really started with the opening of our foster care clinic. We opened the foster care clinic officially on November 30th, 2007, in conjunction with our 2-year anniversary of the Family Justice Center. We didn't really start seeing patients until the first of the year in the foster care clinic. And what that is we have a contract with the Department of Health and Welfare and Boise State University, who provide foster care exams, just like the ones in Boise, here at the Family Justice Center. So any child coming into care in our region here comes through the Family Justice Center for those wellness exams. So that's really the bulk of what our Forensic Medical Unit is doing right now. As we speak, actually right now, right down the hall in our conference room, our local hospital, Mercy Medical Center, is meeting with our SART team, and we're just about ready to get contracts re-signed with our hospital to start our adult sexual assault exams. We had kind of a setback probably 6-7 months ago when a number of, the emergency department head left, and 2 more department heads up that food chain all left the hospital, and we kind of had to start over with our sexual assault program. But the whole new team is here at the table, and like I say, in the other room, getting ready to start this again. We are also, as part of our medical unit, we are beginning, again, on the other piece of our Children's Advocacy Center, we're doing forensic interviews for our kids who are victims of child sexual abuse. And so we have started doing the interviews and are also awaiting the signature of the contract, again with Health and Welfare, to do the same sort of wellness exam for our kids coming in for an interview. The kids who do need the forensic sexual assault exam are still referred to CARES in Boise over at Kevin's Center, and that will more than likely continue for a while. But we are working on just doing interviews and the wellness exams for those kids. So again, the partnership that we are doing is with Mercy Medical Center, who is our local hospital here in Nampa. The Department of Health and Welfare and Boise State University is our collaborative team who is providing funding and resources and the service provision of those exams. And as you can see here, we dedicated our unit back in November to Ellen Marie, who was killed back in 2002 as a result of child abuse, and her whole investigation was based on forensic evidence. And a couple of years ago, when we were wondering what to call our unit, one of the detectives who worked on that case remembered Ellen's case, and we all decided that this would be a great thing to remember her by, and for all of us to remember why we're doing this work. So it's called the Ellen Marie Pediatric Unit here at the Family Justice Center, and we will continue to expand our services. One other thing that we are beginning next week also is in conjunction with the Department of Health and Welfare. Again, we have a child find contract that we're going to be doing developmental screenings on kids 0 to 3 coming into the Family Justice Center, the foster care children, basically any at-risk child who comes to the center. We will be providing the developmental screenings on them.
Okay. Well, thank you, Rebecca. And what we'll do now is start switching to our most frequently asked questions that we've been getting this last year. And to no surprise, it has to be funding. So, Rebecca, since you were the last one up, I'll put you first up. Let's talk about funding. How did you find the money to start this unit at your Family Justice Center?
Well, at the Family Justice Center, we were one of the original 13 President's Family Justice Center initiative sites, and within that, and with the help of Cindy Cook, who is over in Boise, she wrote in a fabulous budget to supply and equip a medical unit that we are going to start here, that we wanted to start here. And so our equipment and supplies came through the funding of the Department of Justice Family Justice Center grant. So that is what funded the equipment in the building. As far as continued funding for our nurses, we have 2 registered nurses and 1 physician's assistant are the ones who come in and do the exams. They are funded by the Department of Health and Welfare. The Department of Health and Welfare's Family and Children's Services, mostly the foster care piece of the Family and Children's Services unit, pays Boise State to do research and evaluation and also service provision, and have that service provision be provided at the Family Justice Center. So it does not cost us anything to have that service here. All we're doing is providing the space. We do get reimbursement through crime victims compensation, Medicaid, donations, all that kind of thing is how we keep it running. And fortunately, we don't have to pay, like I say, for the services.
Okay, Rebecca, thank you for that overview. I'm going to turn to Kevin and Cindy. Sounds like Cindy is the lady with the ideas for funding. So is there anything you would add to your funding?
I'm always looking for funding, so I don't know if I'm a good idea for funding. Basically, our program's kind of struggling a little bit as far as the funding part goes for training, especially for the nurses, for ongoing training and education to keep the nurses current with their competencies. But as far as my salary and benefits, it's a shared responsibility between the 2 hospitals, which is really nice. So they share my wage, and then each of the nurses has a set contractual fee that they get for the exams that they do, and for their call is each paid by their respective hospitals. But any kind of equipment or anything that we use, the primary hospital through which all of the billing is done provides all of our equipment and services that we need. If we need any major equipment, for instance, we're looking for a colposcope, we have to try to find our own funding for anything like that, or cameras we have to do through grant writing.
So we've obtained from some local foundations dollars to buy a pretty high-end forensic camera kit that investigators typically use. And we are currently trying to raise funds to obtain a digital colposcope to integrate into our system. And we the St. Alphonsus Hospital system recently donated to us 2 telemedicine units to provide that link up from FACES to the St. Alphonsus Emergency Room. Just to cover the Child Advocacy Center funding aspects, as I had mentioned, when we started the center, we brought in 2 existing services or programs. The CARES program is funded through the sort of the typical payer sources, Medicaid. They also bill to insurance, and they receive crime victims compensation dollars. And then the hospital, the St. Luke's hospital system, also underwrites their program, I think to the tune of close to $200,000 a year. So they're making a pretty major contribution to that program itself. They are a nonprofit hospital, so they have to roll their dollars back into their programs. And then the equipment, both of these programs moved into our center, into a larger center with more space. They required more equipment. They brought existing equipment with them, but we also did some local grant writing, partnered with a variety of service clubs to buy additional exam tables, equipment for the, to outfit all of our exam rooms. We have 4 exam rooms here in the center. 2 of them are used by the Child Advocacy Center. 1 is dedicated to the SAFE program, and then 1 is shared between the 2. But typically, it usually gets used by the SAFE program if they are, backing up exams at the same time, and that has happened on a number of occasions where we've used both exam rooms. But it is a shared room for basically overflow in the 2 programs. I think that pretty much covers it.
Okay.
One thing for reimbursement for our forensic exams, we do collect both from private payers and also from crime victims' compensation.
Thank you, Cindy, for adding that piece, because I think that one has definitely come up. Okay.
Yeah, it's definitely a different, unique situation in Idaho, and Rebecca's probably already talked about this too. But in Idaho, by legislative decree, we have to bill private payers before we can bill crime victims' compensation. So kind of adds a unique twist.
Okay. Nadia, would you add anything to the funding discussion?
They're all very complicated and eclectic, and I think that that's the beauty of the Family Justice Centers, is it brings so many different sources of funding together. Each is individually leveraged. I can give more detail about each. I mean, we're a county entity, so that's absolutely an advantage, and we're also a former county medical building. So not only were there exam rooms for our clinic there, where the the chairs and the sinks and everything was in place already. It was the relationships and collaboration that really resulted in public health funding being designated both through staff and some additional equipment to the Family Justice Center. The equipment for the forensic exam room on our second floor, that actually got directly located and donated through Hillary Larkin, both the colposcope and the chair and the photo area. So that was directly through Highland. The staff are all full-time employees of Highland Hospital, and through, again, that relationship, they make themselves available to respond, to come here, to do the forensic exams directly here. The START funding is funded through mainly 4 different sources. So it would be direct hospital funds that are, say, designated to the Family Justice Center through the allocation of space for the video relay systems, victims' crime reimbursements, public health funding, and law enforcement. Many of these funds, especially public health, are actually managed through Nancy O'Malley from healthcare, that is kind of a dual funding with the district attorney's office and county. So again, just all very eclectic funding that Family Justice Centers can leverage.
Okay, Nadia, thank you very much. Boy, you should see our questions coming in. There's a lot of questions in the hopper, so we're going to keep moving forward. The next question that we have was frequently asked questions before we start taking questions from the field, has to do with confidentiality and reporting. And I know this one comes in particular for California, since we are a mandated reporter. So I'm going to ask Nadia this first question. How have you been handling the medical mandated reporting regulations, especially when it comes to domestic violence at your center?
Well, again, that is all mainly done through our SARTs, and anybody that is individually medically mandated to report does those reports. At least we hope so, and if we find out, obviously there's accountability. So again, we ensure that any partner coming into the Family Justice Center has strict guidelines and regulations to comply with that. Through the district attorney's office, there's much more direct oversight. So the challenges with confidentiality are in every single component of operating a Family Justice Center. Every partner must sign a confidentiality agreement to become a Family Justice Center partner, and those are renewed annually. We are excited to be soon to launch. It's designed, and I'll be so excited to actually display it hopefully to everybody, is our domestic violence mandatory reporting and referral project. And that's funded through Verizon. That is a website, so that will be directly in all of the hospital's emergency rooms. So the form on a website was actually jointly created through a series of meetings and forums with administrative level hospital representatives that all came together. This was just an amazing process, and agreed on what would be in the form. Of course, it complies with all the state requirements. So on the website, in the ERs, you can go into the website, get the form, fill it out, file it, and send it off to the appropriate law enforcement agency. You can also print out resources for the victim in over 100 different languages. And the reason why I'm mentioning this is because confidentiality is discussed directly at that point with the victim, and if they sign a confidentiality waiver that is provided through the site, they are directly linked in to our navigators, and the navigators just hold all of that information within their own professional, not only confidentiality as a person, but also their job duties, and they then link the client into all the other services addressing the victim's short and long-term needs.
Okay, thank you. Kevin and Rebecca, would you add anything to the confidentiality and reporting question?
I think, yeah, Cindy, I was just going to say, would you mind taking that for Idaho?
Thank you.
Confidentiality-wise, we do a similar thing where we have confidentiality waivers that are signed by everybody. As far as the medically mandated reporting, both through legislature and through hospital policy, we do have to report, of course, any of the obvious child abuse, any of those issues. With sexual assault, it is a mandated report for all nursing within the hospital covered by hospital policy. So we do report all of those. Domestic violence, unfortunately, in Idaho is not a mandatory reporting unless it involves a firearm or a knife.
Okay. And this is Gail. What I'm going to do is just add a little piece from my experience working at the Family Justice Center for 5 years, because it had a little different way of getting to the Forensic Medical Unit. Victims would come into the center. They would sign consent forms, and they would be advised of the different programs and services that were available. When it came to the Forensic Medical Unit, victims were also told that that was a service that was available to them. It was their choice whether or not to have documentation of their injuries. They were also advised in advance that if they sought medical attention in the Forensic Medical Unit, that they were medical mandated reporter, and they would have to report. When I left the Family Justice Center, we had seen at that time over 25,000 clients, and I would say one may have said no thank you, but more once they realized that the mandated reporting part was off their shoulders and their responsibility. They had elected to seek medical attention because they didn't feel like they were the ones responsible for reporting. And I guess what I'm trying to say, and what all of the Family Justice Center directors have come to the conclusion, is that once victims do seek services at a Family Justice Center, they are ready. For the most part, they're self-selecting, and they want to utilize all the services that are available to them at a Family Justice Center, including the Forensic Medical Unit. We're going to keep moving quickly. We're now going to go to benefits, challenges, and then questions from the field. So, benefits. Rebecca, how about you? Will you tell us some of the benefits that you've seen so far having the Forensic Medical Partnership on site?
With our foster care clinic with our kids, the benefits I have seen is we get the kids in here for a specific reason. But we also manage to have a better relationship with the child protection worker, the social worker, who is in charge of that case, because they are located here on site. And there again, we can work with them, providing more services for the kids. One thing that has come of this recently that we're working on another contract with, that we realized when kids are coming into the foster care clinic for their exams, sometimes they have just been removed from the home, and the kids are coming in here sobbing and sad and frightened. And we have realized that those kids need some immediate crisis counseling. And so what we have developed is this program called Bridge Therapy, that because the kids are now part of the state, we can offer this 3-4 session immediate counseling on site while the child is here having their exam done, and work with them to get into long-term counseling, work with the social worker or the child protection investigator. And that has really been an important piece on of our Children's Advocacy Center piece. We hope to be fully accredited as a Child Advocacy Center in January, and that will open doors to some stable funding every year to go directly towards the medical unit. And so that will help us in our efforts to do the interviews, do exams, do more therapy in direct relation to the kids.
Okay, thank you, Rebecca. And I'm working my way backwards, so to speak. Kevin and or Cindy, what would you add to benefits from your center?
You know, with regards to having the Child Advocacy Center in our center, I think one of the great benefits is really the linkage between domestic violence and then child abuse. We have a number of children that do come through and are seen in the Child Advocacy Center that have been witness to very serious domestic violence incidents. And so being able to, have the mom here in our center working with our prosecutors, detectives on a domestic violence case, but also have services available for their children, I think is really great, and it makes that linkage. I mean, we simply can go down the hall and get them in right away and have them seen. And I think that has been very beneficial to us. It's not our domestic violence program has been very slowly growing over the last year and a half, because we're really trying to tie together a system that in the Boise area that has not been well coordinated or tied together. But as it's really begun to grow now in the last probably 6 months, and we're seeing more and more of those benefits between having these programs linked. And I'll let Cindy address the sexual assault program.
I think that one of the most touching things that we're seeing is that in relation back from our victims, the ability for them to be able to say that now they can come into a place and really be heard and listened to and feel that somebody's actually taking heed in what they're saying. We're also seeing a side benefit in our prosecution rates that some of the alcohol intoxication cases are being tried in court now rather than just tossed because they're so hard to try.
Excellent. Okay, Nadia from Alameda County, can you give us a benefit?
There's so many.
Just one. Just keep us going.
I do have a story that relates to Forensic Medical Units with our investigator, Special Victims Officer Randy White, who regularly picks up the medical mandated reports, especially from Highland. He had a particular story where there was a clerk, and she actually is now extremely vocal on the issue, and is a kind of a spokesperson. And she would regularly give him, files of reports, and so he had interacted with her for a couple of years. And one day when he went to pick them up, she kind of pulled back the file, and as he was, grasping it on the other side, and she said, "I need to speak with you," and went down the hall, and lo and behold, she had been a severe victim of domestic violence for a couple of years, and always wore the turtlenecks and So over a week's time, we had triage meetings here. She was brought actually here on her lunch break, and they did do an exam and took photos. And so over the week's time span, it was discovered that not only was her husband a pretty successful person, but she was just terrified for so many different reasons that you all so well understand, of leaving. And so through that week, enough evidence was gathered that on Friday morning, he goes to work. Her whole belongings were moved out, and her children had been relocated to a different school district. We got funding for her and housing for her in a different county. And he was arrested on his lunch break and had no idea that any of that was going on during the week. So, that's just one example of the benefits of co-location, where all of that can happen within a week because of these different essential programs being in one building. I think the importance of a forensic medical unit on site it is absolutely one of those essential, inextricable pieces that you've got to have eventually in a family justice center to enable a victim to not have to maneuver and shuttle between all the different locations and tell her story numerous times, his or her story numerous times, while they're in crisis. And safety is an immediate concern. It's one of those pieces that every center hopefully can get.
Okay, Nadia, thank you. Well, the next question is challenges, and I'm noticing that this is going really fast, our conversation about forensic medical units. So I'm going to give now, change the format a little bit, each of you a question. So challenges, what would you say in trying to start your forensic medical unit, putting all these pieces together? What was your biggest challenge? And Nadia, can you answer that one?
I think first and foremost it's finding an appropriate building and space. And then, of course, the having either in place and or developing, that eclectic source of funding. It takes time and it takes a lot of work.
Okay, I think patience, you definitely summarized it. And I think one thing I'm hearing from all of you is relationships, relationships, relationships. Okay, questions from the field. One of the questions that I had, and I'm going to probably ask this of Kevin and Cindy, how does your center handle domestic violence along with the sexual assault?
Well, our center, we don't do the forensic exams per se for domestic violence victims here in the center. That's actually a goal of ours, is to expand the SAFE program to do forensic evaluations, examinations for the domestic violence program. Currently, if injuries need to be documented, then we have it's generally from the prosecutor's office, an investigator who comes over and takes photographic evidence. And so they will document that. So it's really separate from our SAFE program. Our intent, though, is to expand the SAFE fully into domestic violence work as well.
Okay, then I'll go back to Nadia. Nadia, could you add to that question, is how are you handling the domestic violence cases? And that, what I mean by that is just the domestic violence where they're not disclosing a sexual assault.
You mean the exams, or?
Yes, the exam.
I mean the whole intake shebang. I mean,
just the
specific to.
It's specific to the medical examination of a domestic violence victim with injuries. So how would, because I know you have also a great relationship with your sexual assault community, so how has that evolved into handling domestic violence victims only?
They're both handled the same, of course, separate from, so essentially the representatives in every hospital that have the SART programs also utilize that for domestic violence, as well as our on-site investigators do both.
Okay. Thank you for that one. I'm going to I see one here that really spells out FACES. So Kevin and or Cindy, maybe one of you can take this question. So here it is. Do you have any suggestions for starting a FACES in a rural community that is without a local hospital and the justice centers are located close to an hour away? Where would you begin?
That one's really, really tough because if there is no hospital in that rural community, even a rural hospital, you would have to have significant backing from some source of medical ownership. So a physician somewhere would have to take ownership of starting that program, which is a huge commitment. And I think that's one of the really big hardships that they have, is to have somebody that's available 24/7 when you need it for sexual assault and or domestic violence.
Okay, I think that helps. The next question has to do with volunteer services. Is any on
the last question, I would suggest that community, that they definitely look in though to their county's public health funding, and definitely look into that, where it can then be, staff and or equipment can be assigned to their location.
And I'd like to just add, I think the video relay, or telemedicine as we call it, linkages could be a solution or a way to do that, so you do have that medical backup, that connection with physicians, and are able to have that backing up your examination system if you have, say, RNs doing that work, doing the exams in that local rural community.
Absolutely.
Okay, thank you. I think that's some good ideas to get started. We're going to now shift a little bit and look at the question related to volunteer services. Can you explain, are any of you using volunteer nurses or services to assist you with your forensic medical unit?
No.
Okay, no from Nadia, no from Kevin, and I think I heard a no from Rebecca. So I guess that question would be mine, in the sense of the San Diego Family Justice Center, where Dr. George McLean really did some outreach to try to recruit volunteer nurses, whether they were registered nurses, forensic nurses, sexual assault nurses. And I think that goes back to what everyone else has said: partnerships, 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 and relationships with a local hospital. And I think where he started, obviously, since he was a former ER doctor, was to start in his own hospital and recruit nurses from the existing hospital, and he was also able to create a training program for the volunteers. I think maintaining it is a little bit harder to do. I think we've all learned that starting the revolution is one thing, keeping these wonderful programs going is another. But the San Diego volunteer program for the forensic unit has worked in the past. It's just hard to maintain it, obviously for a lot of reasons, managing schedules and managing the staff at a particular center. So we're going to keep moving. The other question that we received from Memphis, Tennessee, had to do actually with the prosecution. And they wanted to know exactly which cases are being referred, and we're going to focus on domestic violence cases right now for the purposes of this question. How many cases are being referred to your forensic medical unit that are related to domestic violence? And given the answers so far, I'm going to go back to Nadia. What would you say would be the ratio between domestic violence and sexual assault?
It's about, is she saying referred from any source?
I think any source. They weren't specific.
Because of the START program and its origins specifically in sexual assault, and the partnerships then utilizing both those relationships and communication linkages for domestic violence, we get domestic violence referrals here from a number of other sources referred directly to, let me see, the START. It's about 60-40.
And 60-40, is that 60% domestic violence or 60% sexual assault?
Yes, 60 DV, 40 sexual assault.
Okay. And along those lines,
that includes sexual exploitation, child molestation. That includes all that.
Okay. Related to that question has to do with prosecution, which Cindy answered a little bit. But what are you seeing as far as the benefits for prosecution having a forensic medical unit on site? Nadia, I'll let you answer that first, and then we'll go back to Cindy and or Kevin.
I think that the core to that, the benefits are absolutely the the professional, cross-training and relationships is that the quality of evidence coming in has dramatically improved, and thus the percentage of case dismissals has dramatically been reduced. So the benefits are, again, the efficiency of the use of public funds. It's through co-location of a forensic medical unit just as much as the law enforcement co-location with the district attorney's office has dramatically increased prosecutions, reduced dismissals, and thus saved funds.
Okay. Cindy, we're going to go to you and talk about the prosecution and the benefits. And also I'm going to clarify a little bit the question from Tennessee is how many of those cases are now being referred to the prosecutor's office? And what's and I think you mentioned a little bit before the benefits. Can you give us a little bit more?
Well, as far as the benefits for the prosecutors, I think that the prosecutors have come to really love and appreciate forensic medical units. The nurses and physicians assistants and nurse practitioners that work within them do such an excellent job in not only their evidence collection, but in their documentation and photographic evidence of the injury, that is a tremendous aid in the prosecution of these cases.
Okay, and I'm going to just add a little bit there. Before we had the forensic medical unit, and this will be my pitch to anybody that's listening out there, having a relationship with your medical community, especially as a former prosecutor, is unbelievable and it's critical. Before we started our forensic medical unit, we had a nurse come in, a forensic nurse, and she helped us just read medical reports. She helped us analyze photographs, the injuries of those photographs. We would have defense attorneys come in and say it was she was the attacker, she was the primary aggressor. So then we had to distinguish between offensive and defensive injuries. And the other thing that it helped was having someone who had access to the medical world who can give us training on medical terminology, strangulation, and the list goes on. And eventually she was able to develop her expertise and was used as an expert in many of our cases. So cases before where we would have said, gee, we don't know, we would be more willing to negotiate those cases to a lower level or less custody time, but having somebody on site with that medical background just made us feel so strong and fearless that we were willing to take more cases to court and obviously win with that support. The other benefit is having the corroboration in forensic medical documentation. We found that the cases that were referred to our prosecutor's office, either the city attorney's office or the district attorney's office, very few cases ever went forward to trial. Once the defense attorneys realized that there was a medical person who was specially trained in documentation, it was a rare case that somebody wanted to take that kind of medical expertise on in court. So very often those cases would settle, and as I recall, I think Tom Collins, Dr. McClain, and others were mostly on standby, and at the end of the day, I don't think any one of them testified in court. There may have been one, because I could be mistaken, but as you will see from many of the jurisdictions, that is a similar finding. Okay, looks like we're wrapping things up. We've got more questions. I will come up with a way, working with these fantastic speakers today, to answer the questions that were not answered today. We'll probably do it in writing, and then we'll post it on our website. So what I would like to do is now go to one other wonderful resource. Again, I want to thank Dr. Ellen Tolliver for sharing her valuable experience with me, investing her time and energy with us in San Diego to educate and share the way. But she was very instrumental in putting together this Physician's Guide to Intimate Partner Violence and Abuse. And as part of the residency program that was started in San Diego, thanks to Dr. Ellen Tolliver, we were able to give that book to each new resident that came through the Forensic Medical Unit. So it's a great tool for legal professionals. It's a great tool to educate and recruit medical, either nurses or doctors or other medical professionals to your Forensic Medical Unit, either as a volunteer or to find a financial partnership or long-term partnership. We also wanted to share that we have our conference coming up in Anaheim next year, April 21st to the 23rd. So please mark your calendars now. It's going to be a fantastic conference. We'll be. It's a great date.
April 21st is my birthday.
Oh my gosh. Well, then we'll be singing Nadia happy birthday on the first day. So you know we're going to have a lot of fun, among other things. The last but not least, we want to thank our wonderful team who each and every one of them have contributed immensely to the creation of Family Justice Centers, helping other centers, and of course shaping and developing our Family Justice Center Alliance, which is now helping family justice centers throughout the United States and around the world. And this is me. For those of you who haven't met me before, I am just so honored and privileged to be able to work with the three fantastic speakers today who inspire me just about every single day to hear their stories and what they're accomplishing despite all the challenges. And last but not least, to give a big warm hug and a bouquet of flowers to our sponsor, Verizon Foundation, for helping us make this discussion possible. Obviously, given all the questions that we have, this is something that we need to keep talking about. I want to thank those who suggested this webinar. I want to again thank Nadia, Kevin, Cindy, and Rebecca for sharing their valuable time and expertise and a tremendous heart in the work that they do. So thank you all. Please join us again. We have a great conference webinar coming up with Salt Lake City, Utah, where we'll be talking about new partnerships. Have a good day and a great weekend. Bye-bye.
And Jennifer, for all you do.